You're listening to the SoleStrategies podcast with your host, Z. Cohen Sanchez. We hope you enjoy the latest episode and thanks for tuning in. Hello, everybody. Happy Monday. Just going to wait for folks to jump on, as always. Don't know what my hair is doing here today, but that's okay. We're not here for my hair. We're here to talk about Medicare for all. So, let me just share this out. And while I'm doing that, for folks that are jumping on, I will just go ahead and remind you again who we are, what we do. So, my name's Z. I'm the director here at SoleStrategies. We are a political organization that works specifically with candidates that do not take corporate money. So that is our goal. That is why we do what we do. We work with, the Bernie AOC wing of the party. We don't really work on centrist campaigns just because, as I tell the candidates that I work with, and as you're going to hear me say over and over again, those campaigns look very different. We work specifically on movement campaigns. We work with really big, field programs and really just, we just run very different type of campaigns essentially. So, and what do we do within that? So, we work on three different things primarily. We work on field operations, we work on social media, and also emails for candidates. So we do small dollar fundraising via email and social media. But really our big, our bread and butter, what we do really well is we help candidates fundraise, and we help them raise more money essentially than their incumbents, or that's the goal for us. And the reason why is because, we believe very strongly, that, we need money to run effective campaigns. So I'm having some trouble sharing this out, but that's okay. That's why I have a team. Teamwork makes the dream work. Oh, sorry about that. I just had a client calling me. But so I will say that we have the best team on the planet. All of our folks are just amazing. We have folks that have worked on these type of campaigns for many years, and so the team that we work with are just all really incredible people. Okay, so I'm just letting them know to share this out, so that should be happening. So let's get into the meat today of what we're going to be talking about. So today I really want to talk to you guys about Medicare for all. Why is it possible to run a Medicare for all campaign? Is America ready for a Medicare for all campaign? These are all questions that are really important to answer, and that you got, if you're thinking about running for office, but even if you're not thinking about running for office, these are really things that that you should care about and be thinking about. So let's just talk about that for a second. So, I read the other day that, AOC, honestly, she's a lot nicer than I would be probably, was very generous in offering her help for candidates, that were in flippable districts around the country. So I guess that what had happened was that she had offered those candidates support by coming out and doing stump speeches for them, helping them in any way that she could with her powerful influence, which again was really nice of her to go ahead and offer that. I don't know if I would, if I was in her shoes, but she's obviously really, really kind. And so she had offered to go help those folks, and most of them had turned down her help. And, most of them, what I would be thinking would be their reasoning behind why they would turn down her help is obviously because they're afraid of her progressive stances and how their districts would take. So there is this sort of phenomena that people think that New York is this like progressive mecca, that, we're sort of, I would say, closed off from what the rest of this country looks like. And I just want to express to everybody that is not true at all. So I'm actually trying to pull up right now who AOC was looking to support. But yeah, basically, I guess that they don't have names here, but it looks like she just was rejected from helping most of those candidates. And what was funny about it was that, after they had rejected her help, all the folks that had rejected her help lost their seats, and all the people that she helped won their seats. And so a lot of these news outlets started to dig into this and think, well, why is it, right, that the people that she helped won versus the people that she didn't help didn't? Like, there has to be a reason why. And what they discovered in this was that the people that she helped that also supported Medicare for all were the people that won. So I really started to think about, and I think we've all been sort of thinking about this, right? About Medicare for all and what that means for people in this country. And I think that there is a narrative out there that Medicare for all is radical, and that progressives are not on, progressives are too far left, and this country just does not want Medicare for all. And what we're actually seeing from the studies is quite the contrary. Like, what we're seeing from the studies is that Medicare for all is popularity wise amongst folks, no matter where they live, is at an all-time high. And an example of this is that Fox News recently did a poll, and obviously, we all know that people that watch Fox News tend to swing further right? So you would think that people that were filling out that poll likely are more right. I mean, there could be other sort of scenarios where, maybe that's not the case, but I think that for all assumptive purposes, we can say that the people filling out that survey were more right. And what was really interesting about that was that I believe it was 72% of Fox News watchers support Medicare for all, which does not shock me whatsoever. So, for those of you guys who don't know me personally, I grew up, I was born in Los Angeles, in Torrance, California, but I grew up most of my life in Sydney, Australia. Not in the city, but actually pretty far out, but I grew up in Australia. And living in Australia and growing up there, I saw how a Medicare for all system worked firsthand. And, I think that there's sort of a lot of confusion about how the system is paid for and all these other things. And so that's why people think that it's radical. But actually the reality is that the people are, in fact, contributing to the Medicare for all system. I mean, there's a reason why our taxes, by the way, our taxes are right on par here in Portland. So in Portland, we pay about, I think, 31% of our income in tax for our state tax. In Australia, it's very similar. I think it's actually a little bit less than that. I think it's like 30%. So the tax is high, right, in general, but the tax is also high here. So the difference is that in Australia and in countries like that, what they're getting for their taxes is different. It's not that they're like getting taxed, 50%, 60%. I mean, some people, if you're making if you're making an unreal amount of money, could be faced with that situation. But the reality is that the average working class person is not faced with that situation and will never be faced with that situation. Plenty of people in Australia are in businesses, like they're, all of that. And so there is a thriving understanding and community that we are all in this together. And that is a message that folks like Bernie Sanders and AOC and that wing of the party is pushing, because the reality is, guys, is that we are all in this together. And that if a person becomes sick and they visit the emergency room, that is not free. And I think that this is where the sort of misconception comes in, is that I think that people assume that if a person gets sick, they just don't go to the doctor, right? And they, somehow get over it. Whatever. But the reality is that that's not happening, that a person that gets sick ends up actually going to the emergency room. And as we all know, the emergency room, the cost has to come from somewhere, right? There is labor that's happening there. There are doctors and nurses and folks that need to get paid. And obviously a lot of these hospitals are very wealthy, so no matter what, they'll be able to cover that cost. But the reality is it shouldn't be on a specific person or a specific hospital. It should be on a system to take care and make sure that there's preventative care happening. I think that is something that we don't talk enough about, is that do we really want our citizens to get so sick that they end up having to visit an emergency room? Because one, that's very costly, and two, that, what that ends up happening is that you get a person to the point where they're so sick that they're potentially infecting other people. They're potentially, still going to work and getting all of those folks infected. And the more people that they're infecting, the more money that costs us as a whole system. And so that is why there is such strong support out there right now for Medicare for All, because the reality is that it's actually a cheaper system. And this isn't just something that happens in Australia. I mean, of course, like Australia is a pretty small country, right? Like we only have, less people in Australia than we do in all of Los Angeles, the Los Angeles basin. But there are countries like Canada that do this, pretty much everywhere in Europe does this. I mean, it's definitely it is not a radical idea, is what I'm trying to get at. And, what becomes very evident, and we are very statistical at SoleStrategies. We believe in data, and we believe that we cannot make an assumption about something unless we look at data. And what the data is showing us is that Medicare for All, the support for it, is at an all-time high. And it really doesn't matter where you're running in the country. Of course, there's going to be more support for Medicare for All in a place like New York versus a place like Alabama. But in terms of, the support, I mean, there is still overall support for Medicare for All. And so, when you're thinking about running for office, I really want you to sort of think about that, because we get a lot of people that get on the phone with us that say, I just think that my positions are too radical for my district or for my state or for the place that I'm running. And the reality is that unless you've actually done statistical analysis, unless you've actually pulled out the data, there's no reason to actually to think that, because people go ahead and they make a lot of assumptions based on no data. And one of the ones that we hear really frequently is it's hard to get donations in the holidays, right? That is a myth that there's no statistical data to support that. Absolutely none. And that's the same thing with Medicare for All. And any position that you're thinking about running on that you might think is too radical, I really just want you to think about, is this an assumption that you're making in your head, or is this actually an assumption based on data? And if it's an assumption based on data, I mean, totally, by all means. But the reality is right now, guys, is that Medicare for All is absolutely a supported position. And in fact, more supported than some of the centrist plans like, building on Obamacare and the Affordable Health Care Act and things like that. I think that the reason why that is because people have seen that system in practice and understand that there is a very high cost to some of those programs. So I really just want folks to think about that. I'll sort of bring in like a personal story here as well about, why we really support these candidates and why, Medicare is important for everybody, not just for individual folks, but if you're a big supporter of business, this affects businesses as well. So for those of you guys who don't know much about us, we have a pretty small, not a small staff, I would say. We have probably, I would say 8 people that work for us. They're not tiny, but small, right? And everybody is very young. Everybody, is under 30. So we don't have a lot of folks with pre-existing conditions. Like everybody is, for the most part, I would say, pretty healthy. So if you're looking at us as a group, right, and like buying health insurance just for our company, some of the figures and packages that we were looking at, we're starting at, the lowest amount being $4,000 a deductible per year. And, if you're a healthy person, most people won't even reach that. And the monthly cost on that, guys, was incredibly, incredibly high. So this isn't, if you are a big supporter of business, there are libertarians out there. There are folks that are more right-leaning that think that, Medicare for All will be a problem for businesses. It's actually, statistics show that it's actually going to be much easier for businesses because the business doesn't have to actually incur that cost, right? So instead of having to worry about, oh my God, will my employees get insurance? Are they going to be okay with the deductible? Because that's also a concern, right? Is that even though you buy insurance, are they actually going to be able to meet their deductible? And, when you have a Medicare for All system, this is all taken care of. This is all good. It's all okay because people will get care no matter what. And that's the system that here at SoleStrategies we are working towards by helping candidates like you folks that are watching to start a real campaign. And so, I really sort of want to encourage you guys to really think about this and think about, why is it that AOC went to these spots and why did they win? And I want you to look at the data yourself. Don't take it from us. If you don't want to take it from us, that's totally fine. But then look at the data yourself and ask yourself why that happened. Because we really need to start questioning these things as progressives. We have definitely been fed a certain message from the media and from other places too about what our neighbors care about and what we care about as Americans, and the reality is that a lot of those are myths that we need to really start debunking. So guys, the reality is that yes, this election is technically over. I know that Trump has not stepped down, and that is a problem within itself, but we could get into that all day. But the reality is, guys, is that at some point, Biden is going to be stepping into that position, and we need to be holding him accountable as of today. Really as of last week, the second that he won. And, the way that we can hold these folks accountable is that we can run for office ourselves. We're not going to get any of these things done. We're not going to accomplish anything unless we actually run ourselves and get ourselves into these positions. We need one of us in these roles, and you are that person. If you're listening to this, if you've bothered to be listening to these podcasts, these lives, then you would understand how important it is that you step up and help out. Or maybe it's somebody in your community that you're willing to stand behind, and that's okay too. But either way, we need to be putting in this work, because the work is not over. The work has just really started, and we have a long, long way to go. So if you are thinking about running for office right now, I want you to do a couple of things. I want you to, one, get in touch with us and tell us what you're thinking about running for, and we are going to get you a full plan of what we think that you need to be doing. And newsflash, that's going to be fundraising. And so one of the things that we're going to suggest to you guys early on, those folks that are serious about running for office, is we are going to put you into a Kickstart fundraising program that we have here at SoleStrategies. It is like a Kickstart fundraising boot camp. If you have never fundraised before, it is exactly what you need to set up a successful campaign. When you're looking at any of these progressives that have just won their seats, Cori Bush, Jamal Bowman, Mondaire Jones, these folks are hustlers. These folks put the hours into call time. They put the hours into their volunteer program. They put the hours in, and that is how we win seats. We're not centrists. We don't have money to go and buy a ton of ad time and not have a field program and not do any of those things. That is not the type of campaigns we win. We win campaigns when we are face to face with our neighbors, having these conversations about how important it is that we change the system in this country. That's how it is. Kylie said it's crazy that the U.S. doesn't have Medicare for all. I mean, she's right? Like I know Kylie is in Australia, and to us it's second nature. I mean, healthcare is a human right. Period and full stop. That's it. There's no and ifs, buts about it. But here we're still having that conversation. And if we want to win that conversation, that Medicare for all is a human right, then we need to have people stepping up and running, because the reality is, guys, is that politics happens on the local level. I know that, obviously these big decisions are happening at the federal level, but those folks are influenced by what's happening at the local level. And don't let anybody tell you otherwise. It is not just something that a person comes into federal office and they're not listening to anybody, or any of the lower level seats. They're not listening. No, I mean, they are listening to all of those people. They're part of their community. They're listening to their state senators. They're listening to their assemblymen. They're listening to all of these folks because they know that they have influence within the community. So if you can step up and you can run for a seat like that, and by the way, guys, a lot of these seats are not super difficult seats to win. I mean, it seems really intimidating, but when you have a plan and when you're working with professionals, it's really, really easy. So, and not really, really easy in the sense of like, you're not going to have to put in work, but it's easy in the sense that you don't have to think about what you need to do next to be successful. And that's where a lot of folks sort of have issues, is that if you've never run a campaign before, how would you know what to do first? How would you know what to do next? And that's exactly what we help you do. We walk you through this process every step of the way. You're not alone. And, you know, we do it by building communities. You know, the Kickstart fundraising program that we have right now, the current cohort that's in right now, they started on November 5th and they'll be wrapping up on December 5th. These folks are from all different places, all across the country. And really, guys, it's inspiring to see them. I mean, we have 13 candidates from everywhere, from New York City running for mayor to folks that are in Akron, Ohio, you know, running for city council. I mean, and everywhere in between. It's amazing. The lowest level seat you can think of to some of the highest level seats, people running for Congress in Texas, you know, and what it really is showing us is that people are willing to step up and make this happen, but they need the direction to do so, and they need the community and that support to make it happen. And that's the reality, guys, is that it's really hard to run these races by yourself, especially if you don't have not just the, you know, the actual support in terms of what you need to do next professionally, but also the support that you need from comrades, right? From people that are in this work as well that are struggling. Because as progressives, we have a lot of walls that we come up against that centrists don't, and that Republicans don't. We have a very different battle ahead of us. And so we need to work together to make sure that we don't have a repeat of what just happened. Like, again, you know, obviously I'm really grateful that Joe Biden and Kamala will be the next president and vice president of the United States. I am not thrilled about how that went about, and I'm not thrilled that it was such a close race. We cannot afford to just be getting folks by, you know, by a couple of, you know, just a couple of states against a dictator. I mean, that isn't a win. You know, that's not a long-term win, we should say. It's a short-term win. Glad it happened, but this is not a sustainable way for us to continue this movement. And that's why you have folks like the Latinx community in Arizona organizing on the ground. That's why you have folks in Queens, New York organizing, like the Queens Reformers group and folks like that are organizing on the ground. These groups understand that we don't have the time to play around like that. We don't have the option to see what happens, right? We're not at that stage in history. We're at the stage in history where we need to make serious changes if we're even going to have a country for our kids to live in. That's how serious it's gotten, is that we really need to take it that seriously. And even for those of us who don't have kids, we need to take it seriously because, you know, the African proverb, we should always be thinking 7 generations ahead. We're not doing that right now, and we need to be doing that. We need to be thinking 7 generations ahead. So, you know, that's what you can do. That's how you can step up. That's how you can be remembered. And, you know, we sort of ask folks, you know, at SoleStrategies, is this your moment? And for a lot of us, we might not feel like it's our moment right now because we're tired, because, you know, we feel like we've put a lot of work in elsewhere. But the reality is that it really needs to be your moment because we're at a time in history where we don't have the option to be comfortable anymore. Because if we sit comfortable now, it's going to be a hell of a lot uncomfortable later. So guys, again, we have 1 space left for our December cohort. Our cohort for the Kickstart program starts on December 10th and we'll be going through January 10th. And guys, it'll be so fun. Like the group that we're working with right now, as I said, is inspiring. We are so excited to see their campaigns take off. I mean, really, they're all in a position right now because the program is so good where they are about to really take off. They're about to run a serious campaign and they're about to have a lot of centrists be not very happy about that. And that's exactly what we want to do. So please, guys, again, reach out to us. Let us know what you're doing. And I hope that last position in the December cohort is going to be the position that you're going to fill. All right. Thanks, guys. I hope that everybody has a wonderful, wonderful Monday. Stay safe and keep organizing.